to the screen that I need it on. And then there's a new thing in this particular version of the toolkit, which is something called considerations for practice. There's three main ones that have been highlighted. The first is social well-being, then economic co-benefits, and the third is considerations for small and medium-sized communities. What's, I think, very important to take into account with regard to these considerations for practice is that they were developed from user feedback. They are by no means exclusive. There are many other considerations for practice, but these were the ones that came back most consistently from users as being important, but also applicable across all 5 features. We can get into this a little bit, we will hopefully get into this a little bit later towards the end of the presentation. But social well-being is there largely in part because social well-being plays an incredibly important role in people's health, especially at the population health level. The effects of constant stress, just as one example, actually are quite significant in terms of people's long-term health outcomes. And social well-being is something that is deeply influenced by the built environment. Economic co-benefits, as I'm sure all of you understand, are incredibly important in planning decisions. To not have any economic or not be able to demonstrate any economic co-benefits to something which might in theory be otherwise healthy is like trying to push a car up a hill. It's virtually impossible. And then in terms of small and medium-sized communities, this consideration for practice is there because so much of the research and literature on healthy built environments, the links between urban planning and health, is really based in large cities. That's where you find the vast majority of the research, at least up until now. And yet in Canada, and certainly in the Atlantic region, we have predominantly small and medium-sized communities. And if you're wondering what does that mean in terms of size, from what I can understand, small is considered anything less than 30,000. So that really is something that we would be interested in considering in terms of any practice if we're going to apply the toolkit in this region. Is the presentation being recorded? Asks Claudette.
Yes, Claudette, the presentation is being recorded. I was just going to cover that off during my closing remarks.
Excellent.
Thank you.
So relevance, at least some relevance to planners. One of the things that the toolkit, one of the uses of the toolkit is as a conceptual framework and communications tool. It provides a means of structuring the discussion for planners. Now, granted, this toolkit is written for health professionals to assist them in articulating well-informed and credible responses within local government planning processes and decision-making. That's the origin of it. However, it really could be readily used by other stakeholders, as I'm sure you could imagine. For example, key messages and principles described are aligned with standard planning and design imperatives relating to compact and complete communities. So this is something that not only planners, but also community representatives or municipal representatives, community leaders could also draw upon to bolster arguments or even to find new ways to make their communities better. Planners, moreover, may find the health evidence provided is helpful to build their own case for applying best practices in planning to communities, developers, and city councils. So that's some of it. And here we have a quotation from a planning manager in Kelowna who makes the point that the toolkit adds credibility to local community initiatives and requests for resources. And I think that's actually quite important as well because it makes the decisions a little bit less arbitrary when you're making the argument for one choice over another. All right, so let's see now. I think that's pretty good. Let's take a tour. Unless there's questions now, please feel free to include them in the chat. But I think the tour of the different features will probably help clarify the sort of structure of the Linkages Toolkit and its purposes. So neighborhood design. What is healthy neighborhood design? So I'm sure you all know what it is, but just to get it out there on paper, so to speak. Healthy neighborhood design in the context of the toolkit is design that is reflected in diverse neighborhoods where all people can live, work, play, connect, and access amenities. Healthy neighborhood design is facilitated by land use decisions which prioritize complete, compact, and connected communities. So in the toolkit, elaborated our planning principles to achieve this. So create complete neighborhoods through mixed land use, build compact neighborhoods through efficient planning, enhance connectivity with efficient and safe networks, and prioritize new developments within or beside existing communities. So we won't have time to go through all 4 of these principles. So I'm going to pick one, the enhance connectivity with efficient and safe networks, and we're going to look at that one. So the idea here is that compact street grids, sorry, that should be grids, increase safety, enhance connectivity, increases active transportation and physical activity. That's sort of the underlying core of the link between health and this particular planning principle. This is all laid out in the toolkit, by the way. So if we look at that 3rd planning principle, the enhancing connectivity, and we look at the evidence-based planning solutions that the toolkit highlights, it's things like to prioritize compact street grids and connectivity and intersection density, so there are more direct routes, reduced travel time for active transportation, and other features as well. Quiet road bikeways or off-street bike paths with clear signage are another evidence-based planning solution. And that one I think is particularly relevant to St. John's. I imagine it's also relevant to other communities in Atlantic Canada. Trails and pathways that are easy to access and actually go somewhere is another evidence-based planning solution that I don't think strikes anybody as a surprise, but it's good to know that the evidence is right there. And interconnections to this type of neighborhood design approach include transportation, green spaces, housing, and considerations for social well-being and economic co-benefits. So I'm going to skip the research references because I don't think they're very easy to understand, but I'll give you just one example of how the roadmap evidence diagram sort of explains how some of this works. So when you're building compact neighborhoods through efficient planning, what you're really doing is changing how people make choices about transportation. You've actually changed the set of choices that they have to choose from. And as it turns out, people in more compact neighborhoods will more often choose walking and cycling to driving because it is more convenient, because it might be just as time efficient or more so, as a matter of fact. It may be cheaper, and of course, it has other benefits like social well-being as they become more interconnected with their community, as they see people while they're walking, as they engage with their neighbors or other people who are in the neighborhood, and that kind of thing. Of course, it also has health-related outcomes in terms of cardiovascular mortality because you're actively transporting, you're walking, you're getting about. It can have benefits for respiratory health, and also a decrease in stress and an improvement in mental health. So one of the things to notice here is that one decision or one evidence-based planning solution can have multiple impacts, and those impacts can be interrelated. All right, and a lot of those impacts can have can come back to have an effect on those considerations that we were talking about, like social well-being, economic co-benefits, and such. Okay, I don't think we have to worry about that.
No.
Okay. So the next core feature is transportation networks. And the planning principles that are outlined in the Linkages Toolkit include things like street designs, which prioritize active transportation, to make active transportation networks safe and accessible for all ages and abilities. So an approach that's like universal design. To design connected routes for active transportation and support multiple modalities at once. And to consider the aesthetics of road, rail, and waterway networks. I imagine that this is not news to any planners. I think this is probably old hat. And the real interesting part might be how it relates to health. So let's take one example in particular that's kind of near and dear to my heart, which is consideration for the aesthetics of road, railway, and water networks. There are several main arteries in St. John's where we live that are notably intimidating for anybody who is walking or pushing a stroller, in a wheelchair, or riding a bike. So I take a lot of note of this kind of thing. Why are aesthetics important? Because they actually they have been shown to promote physical activity. They increase a sense of safety and comfort with that transportation network. And at the same time, no surprise here, decay and neglect tend to inhibit use and social engagement, and of course, reduce that sense of safety. So if we look into the Linkages Toolkit, you'll see that for this fourth planning principle under transportation networks, there are a few evidence-based planning solutions that are things like emphasizing pleasing features, art, natural scenery, human scale, architecture. A fascinating study was done, I believe, in Toronto by some psychology researchers rather, where they measured heart rate and other biophysical responses that are related to stress as people walk through different neighborhoods. And brutalist architecture, concrete embankments next to highways, all of that kind of stuff really did precipitate a stress response. Whereas that kind of human scale architecture, as you might find with storefronts that are smaller in scale, neighborhood parks, that kind of thing, promote senses of calm. That is to say that they are welcoming and promote a sense of safety for individuals who are going through it. This is all sort of subconscious stuff. It's not that people necessarily think about that consciously. I mean, they might, but it's not necessary. Another evidence-based planning solution is to maintain road, bike, path, and waterways in good condition. Again, this is no surprise. Integrating aesthetics with functionality, for example, having good lighting and appropriate rest stations, and I might also include garbage cans, public garbage cans, can also really help improve the impact of good aesthetics for people using those transportation networks. So here's the evidence diagram for this particular planning principle. So the two things here I think that are of interest is that it promotes active transportation in particular through various mechanisms, and also increases social well-being. Getting out and about is good for people. And I think after the lockdown of the past few months, we all know that very intimately. Promoting social engagement is also very good for neighborhoods rather, and people's sense of well-being. One thing that I do think is missing here, and I'm sure you will have noticed other areas where you think maybe something is missing as well, is the economic co-benefits of having aesthetically pleasing transportation networks. The Highline Park, which is itself a transportation network in New York City, is one example of that. My parents happen to live in Ottawa, and they live close to the canal, and that's a great example of it as well. It's a very aesthetically pleasing stretch to use when you are transporting yourself. It crosses 2/3 of the city. And of course, because of the amount of foot traffic that is close to those ways, you see a lot of business opportunities, and they are maintained by that foot traffic. So, oh, excuse me. The third core feature is natural environment. So what is a healthy natural environment? It's one in which green spaces and natural elements are protected, incorporated into the built surroundings, and accessible to all people, including children, low-income residents, and people with chronic conditions or disabilities. And I think this is actually quite an important feature. Community planning, which preserves and connects surrounding natural environment, can have significant health and well-being impacts. And I think that idea that it needs to, or it is most effective when it is accessible to all, is something that's important to hold on to. So the planning principles that are laid out in the toolkit include preserving and connecting environmentally sensitive areas, maximizing opportunities for everyone, like we just mentioned, to engage with the natural environments, reducing urban air pollution by expanding natural elements across the landscape. And I think this is where you can see how the big city urban environments really play a predominant role in the development of research and this particular document. And mitigating urban heat islands by expanding natural elements across the landscape. And of course, this is going to be of increasing importance with climate change and global warming. So let's take one as an example, the mitigating urban heat islands. So as you probably know already, extreme heat, especially extreme heat at night, is strongly linked to illness and death. And access to heat shelters and lower ambient temperatures reduce both of those. And so it's, again, it's the nighttime heat is particularly a problem. So the evidence-based planning solutions that are outlined in the toolkit include exploiting the cooling effects of vegetation, including agriculture and bodies of water through evaporation, reflexivity, and some other properties to lower extreme heat overall throughout the course of the day. And to increase vegetation, trees, landscape architecture throughout neighborhoods, including in transit hubs themselves. So these are some of the evidence-based solutions that we propose.
Now there's a diagram for you.
Yeah, so this one is a bit more tangly. So there's a couple of things going on here. One of them is air quality directly through CO2 removal and air purification, which has a bunch of different impacts. One of them, the reducing of temperatures in general, can also be seen to have energy savings for homeowners, economic co-benefits for those homeowners, and recreation and tourism. And I think we know that one quite well because cities that are green, that have lush gardens, that have sort of noteworthy natural installations or preserved areas tend to be visited specifically for those reasons. And I think St. John's, and I'm sure other, I know in fact other Atlantic Canadian cities or towns can say the same because they're very beautiful. Outdoor air quality is strongly linked to cardiovascular mortality and respiratory health, of course. Noise exposure itself, which is reduced with natural environment areas, is a significant stressor that sort of goes unrecognized, but plays quite a role in your hormonal stress responses, which then has cascading effects on your physical and mental health. And of course, ambient air temperature, as we mentioned before, is directly related to heat-related mortality and morbidity. So all of these things end up being quite interconnected and have impacts and effects that might not be readily observed or thought of at the initial stages of developing, for instance, a housing development in a suburb. And so, you know, it's quite common that you might see suburbs where they've just raised all the trees and there's no real parks around. And that does have actual health impacts over the lifespan of the people who live there. So food systems is the fourth core feature. So what's a healthy food system? It's a system that supports population health by maintaining equitable access to affordable, safe, nutritious, and culturally appropriate foods. Accessibility and affordability of healthy foods can be supported through land use planning. It's something that's really important to remember, and it's something that, of course, has been lost through just the natural development of so many towns. If you look at where the farms were that fed those towns 50 to 80, 100 years ago, they're now largely malls or suburbs and that kind of stuff, which is a pity. And I think we're starting to realize how important it is to hold on to those agricultural areas that we have that are close to towns or close to the center of towns. So the planning principles that are outlined in the toolkit include increasing equitable access to and affordability of healthy food options, and that is not just in terms of agriculture, but also in terms of the location of retail outlets and those kinds of things. Protect agricultural land and increase the capacity of local food systems, which is sort of more what we were just discussing or talking about, and to support community-based food programs. And I think we all sort of know that this is where we're going with the rising popularity of farmers markets and pop-up farmers markets and home gardening and community gardens and all the other things. I guess what I mean to say by that is that it's more than just a fad. It has real impacts on population health outcomes.
And we've certainly seen that with the COVID, you know, food security and Snowmageddon have been really on the popular agenda.
Yeah, and it's a particular challenge for a place like Newfoundland and Labrador, but also the other Atlantic provinces where we have quite long winters and quite challenging growing conditions. Certainly on the island, the soil quality isn't great, and the preponderance of greenhouses is still quite low. So we'll probably see changes to that. I was reading about how the amount of produce that is grown in the backyards of Mississauga is more than all the produce grown in the province of Newfoundland and Labrador together. So, you know, sometimes it's not always the big scale industrial agricultural approaches that have the only way of making an impact. It can also be smaller ways. I want to talk just a little bit about protecting agricultural land and increasing the capacity of local food systems. In supporting local capacity from farm to table, not just one aspect of it, but through the whole way, there's a real increase resilience to outside stressors for those communities. And food self-sufficiency has been shown to directly support healthy eating. And we have some really great examples of that among communities along the Labrador coast that have gone from extreme precarity in terms of their food security to increasing food self-sufficiency and resilience. And even though it's only been a relatively short period of time in the context of a lifespan, we're already seeing changes in population health outcomes. So in terms of some evidence-based planning solutions to actually achieve this, the Linkages Toolkit proposes an increased mix of land use, especially for produce, as opposed to husbandry, animal husbandry, and that kind of thing, and access to retail options. So by that, there's things like supporting farmers markets through bylaws and zoning, which I think has really taken a turn lately in Atlantic Canada. Perhaps Newfoundland may have been the last, I suspect, to really come around to that. To support residents growing their own food, and you can think of the controversies that have happened with regards to people trying to have vegetable gardens in their front lawns and neighborhood associations becoming unhappy with that. And to protect and incentivize farming on potential or actual agricultural lands. And I think this speaks to those farms that are relatively close to the cities or towns or have become enveloped by urban development. And there's real value in actually trying to maintain those farms where they are. Julia wrote, we have had quite an increase in applications for chicken coops and greenhouses in Torbay, plus some beekeeping. I think that's very exciting. I would love to have a chicken coop myself, but my backyard is just a little bit larger than a parking space. And at the moment, my family wants it more than they want chickens. But yes, I've definitely seen that there have been an increase in chicken coops and greenhouses throughout the city and throughout the region of St. John's.
And even walking around downtown, especially, you know, just post COVID-19, you can see all kinds of planter boxes and being installed and populated with vegetables. It's amazing to see.
It is. There's
Once
been
you
a real
start looking.
There's been a real boom, and I know that there's I know that some of my neighbors are all keen on trying to get a new community garden started where I live, and to complement that with bees. I think there's real pride in the health of bees in the province, which in itself is a natural resource that has value. So if we look at how protecting agricultural land and increasing the capacity of local food systems plays out in terms of impacts, it's a mixed bag. There are a variety of issues to consider, and this is where planning really comes to the fore in terms of trying to mitigate those negative impacts while emphasizing emphasizing the potential benefits. So one of the impacts is, you'll see here, ethnocultural vegetable production. So those are vegetables, fruit and vegetables really, that are appropriate to the people who are eating them. And the more you can do that, the better diets you're likely to have. And so while there will always be some people who are willing to try new things and who are adventurous in terms of their food, you want to also aim to try to reach the most people possible. And of course, if you live in an environment with changing demographics because of immigration and migration, you want to take that into account and try to accommodate and make the most of opportunities to feed people who might be used to other vegetables and fruits than what is necessarily local. You'll see there that agriculture is linked to poor or poorer outdoor air quality, fertilizer use, which is linked to well water issues, as everybody knows from the Waterton debacle that happened, I guess, 20 years ago. And those are important. Those are important things to keep in mind from a planner's perspective. Direct farm sales tend to increase the consumption of fresh produce, which is an interesting phenomenon that I don't quite understand, but also is linked to lower diabetes rates and healthy weights. And of course, the whole phenomenon of farmers markets tend to be very social. It gets people out, and that can drive or at least help potentiate the consumption of healthier foods, which I think in itself is kind of a fascinating knockoff of having these farmers markets, because people are going not just for the shopping experience, but for the socializing experience. And that in itself contributes to social well-being. And one last thing I wanted to mention, which isn't actually addressed in the Linkages Toolkit, but I think is an important one, is the local economic effects. You know, $1 spent on a local business is going to be recycled much more than $1 spent on anything that's an import. And I don't know exactly what the situation is in the Maritimes, but certainly in Newfoundland, we have a lot of money leaving the island because we tend to buy our foods from away. So the last one is housing. So what's healthy housing? Well, healthy housing supports healthy living by protecting people from health hazards inside and near the home. It is safe, affordable, and accessible to all. And that safe, affordable, and accessible to all is crucial. Design, quality, and affordability of housing options have a critical influence on health and well-being. The planning principles are pretty straightforward. Prioritize affordable housing options through diverse housing forms and tenure types. And I think that is really key. Diversity is important. Ensure adequate housing quality for everyone. That is, everyone throughout the income scale and abilities. Provide specialized housing options to support the needs of marginalized populations, and to site and zone housing developments to minimize exposure to environmental hazards. So if we look at one of these, prioritizing affordable housing options, lower housing costs mean healthier diets because there's more disposable income. It means better access to medication and better adherence to medication. It may reduce social isolation. It's a complicated one. And it may promote longer stays and social networking because people are more likely to stay in their neighborhood if they like the house that they're in. So some of the planning solutions: prioritize a variety of diverse housing options within neighborhoods to support staying in community and disposable income and lower stress. So the staying in community thing is interesting. You know, like you have a lot of empty nesters who will be in these large suburban developments, and they have to go somewhere, or they would wish to go somewhere that maybe doesn't have staircases or not quite so many rooms that have to be cleaned. And they might want to stay in their neighborhood, but there are just no options. There are no smaller units or that kind of thing. And yet they would take advantage of them if they could. And I think this is particularly relevant to those smaller communities throughout the Atlantic region, where you don't have those kinds of options. And you'll see that the few communities, let's say, that do, especially here in Newfoundland around the Bay, that do have those options, end up drawing in people from the other communities once they hit a certain age and they want to downsize a bit. Create incentivize energy efficiency. I think that's a pretty clear one. Ensure safe and welcoming common public spaces, or you might say places, to promote social cohesion. So in prioritizing affordable housing options, I'm just going to draw your attention to a few of these phenomena Access to affordable housing plays a really important role in the financial stress of families, or at least couples, and that in turn plays a significant effect on general health and intimate partner violence, or what used to be called domestic abuse, as well as overcrowding and violence from there. So access to affordable housing has some really very direct health-related outcomes that aren't just lifespan oriented, but also directly oriented to the situations of the people living there at the time. One of the points that they mention is that it leads to a more effective distribution of public resources and services. Sorry, they don't mention that. I think I mentioned that. I think this is one of the things that they should have included and hadn't. So that's why I have the question mark there. But we can discuss that a little bit later. I'm just going to hurry up a little bit because I'm mindful of the time. So in the toolkit, towards the end of it, you'll come across more description for these 3 considerations for practice, which are considered sort of core. In terms of social well-being, what they've drawn from the research is issues like the following. So street connectivity and active transportation are closely linked. Quantity and quality of green spaces. I think we all actually kind of know this intuitively, because if you're looking for a place to live, proximity to a really nice park is always something that's going to boost the value of the house. Perceptions of safety are key. Placemaking, public art, and heritage conservation are all closely linked to social well-being as well as community engagement. Economic co-benefits of healthier built environments. So complete and compact neighborhoods are considered to be economically more dynamic. Public infrastructure and service costs are better distributed. Household expenses tend to be lower. Traffic safety is increased, etc. And there are more in the Linkages Toolkit. I only included those that I could fit on a single slide. Economic co-benefits of active transportation. I imagine that we all know these, but nonetheless, just to go over them, they include things like improved transportation options for non-drivers, your own physical and mental health and well-being, and others. Economic co-benefits of green spaces, open space preservation impacts, for example, better air, water quality, the availability of recreation, food production, and disaster mitigation. Trees specifically are considered a very important factor in this. And you can find economic reports, studies that actually try to quantify what the impact of green space is. And I think there was one that's mentioned in the Linkages Toolkit from the state of Washington that was looking at something like $6,000 to $7,000 per acre of value for these green spaces. And small and medium-sized communities. So these are, I think, perhaps the most important considerations for planners in the Atlantic region. Safety concerns about active transportation are major. As you can imagine, all those communities where the houses basically line a highway that is the main street. Household expenses, public infrastructure and service costs, those are major issues. Limited public transportation options, if any, and so improving those options for non-drivers, especially when you think of older residents, is going to be very important. And those transportation options also have an impact on health and well-being in terms of public engagement, in terms of access to services and such. Access to recreational facilities and green spaces can be a real challenge for some smaller communities, as well as access to nutritious foods and exposure to environmental hazards. There you go. Thank you very much for participating in the webinar. We have some time for questions?
Yes, we definitely have a period of time for discussion and questions. I think that we've Pablo certainly covered some real key planning principles and fundamentals. And I think his closing slide, I'm assuming pedestrians flock back to Wachter Street, is something taken relatively recently.
It is. It's from the new
pedestrian mall.
Yeah, the new pedestrian mall. Mm-hmm. That's right. Which is just like the old pedestrian mall.
So does anyone have a particular question for Pablo? You can certainly feel free to unmute yourself and ask it, or to send it in through through chat. I certainly think myself that I've seen, you know, in a physical way, you can see some of these planning principles being applied. You know, we're all aware of, you know, an emphasis in particular on food security. You know, certainly the loss of agricultural lands, especially in some of our larger cities and towns, as those have disappeared, and now, you know, trying to turn the tide and reinstitute agricultural operations is, you know, and to improve access to locally grown food is certainly a big theme that we're seeing in the planning world.
Certainly the quality, one of the things that I've really noticed over the past few years is the change in perception in terms of the importance of parks. And I've seen that because I live close to a park in St. John's called Bannerman Park. And for a long time, it was relatively plain, and it had a reputation as being unsafe, and you wouldn't want to be there after sunset. And fair enough, the only people who were there after sunset tended to be people who were drinking out of brown paper bags and smoking. And they renovated that park, and they made it much more welcoming for children and families. They made it much more accessible and well lit with better paths. And now it is filled in a way that is not just health promoting, but also enhances a sense of safety and comfort for people. And so it is in fact populated well into the night with lots of people who are doing all sorts of healthy things. So that's one of the ones that I've noticed.
So one of the things that I've learned from Pablo and his presentation is that it doesn't necessarily have to be a big project. It, you know, often small steps can make a significant impact. So it doesn't have to be things like, you know, a light rail system, or, you know, right, to promote, you know, transit options. But in fact, smaller things like, you know, bicycle paths or creating safe spaces for bicycles, all of those feed into positive health outcomes.
Indeed. I'm curious, there was some of the people involved with the Health Linkages Toolkit were asking me to what degree people in the Atlantic provinces, what degree planners in the Atlantic provinces are using the toolkit, because they have some data, they have some information about its use in British Columbia and in Alberta, but nothing out here on the east. So does anybody who's on the webinar, has anybody used this in their planning practice? You can speak up or just say something into the chat. And have you known about it? Is this the first you've heard about the Linkages Toolkit? Or is this something that's sort of on your radar, but you just haven't gotten around to using? Anyway, I'll let you do that as you're going along.
Yeah.
Anything else?
No.
Any questions? Oh, I know one more thing for you. I have a bunch of resources, including the Linkages Toolkit itself, a 2-page summary that I had wanted to share with you through this platform, but we couldn't figure out how. And so I'll just leave that with Elaine, and maybe you could send it out as a follow-up email to this message.
Absolutely. All right. Given all of the
identified, so Justin writes, given all of the identified positive health outcomes, are there examples of pressure to try and attach dollar figures to the outcomes? Yes, there's definitely all sorts of work that is done. So this is a great question. So there's two things here. The first is to try to quantify what the impact of these healthy built environment features are on population health outcomes themselves. And then the second is, what is the impact of the shift in those population health outcomes on economic outcomes, economic costs and benefits and that kind of stuff. And I have to say, I'm not a big believer in health economic research. It's a very murky field. But certainly it is the case that chronic disease is incredibly expensive at the societal level because you're looking at a large number of people who are being affected. So it's not the kind of thing where only a few people, relatively speaking, within the population have an acute situation. It's rather a large proportion, a high percentage, and they're going to be living with that state over a long period of time. It will affect their productivity. It'll affect all sorts of things, all of which cost money. So yes, there is definitely examples of pressure to try and attach dollar figures to the outcomes. And I can try to put together a short reading list of some examples where that's been done, and I can include that as well with the other documents for Elaine to send out in a follow-up email.
Yes, so Julia's asked, is there some form that this presentation is going to be shared? And I wanted to say that this presentation and the slides have been recorded, and the Atlantic Planners Institute will be sharing those. They have a YouTube channel, which I never knew about until today. So what I'll do is I'll get those links, and I will share it with the participants and through our various mailing lists, along with the information that Pablo has provided. Just in kind of, we're just going to start cluing up now, I think.
Just before we do that, for Julia, if people are interested in trying to hear a bit more about the toolkit from a planner's perspective, one thing that I'm going to do is I'll see if I can find examples of planners who use a toolkit in real life situations that are somehow relevant to Atlantic Canada. So I think for downtown Vancouver might not be as great an example, but Kelowna might be actually quite on the money, and see if we can share those as well. How about that?
Yes. In addition, CIP has had a subcommittee, a committee formed working on healthy built environments, and they actually have produced a booklet of professional practice. So that's available on the CIP website as well. So just in conclusion, Pablo, thank you very much for coming on to the first webinar that I've had to moderate. It's certainly been a learning experience, but thank you very much. And there are 4 more webinars coming up through the Atlantic Planners Institute and some of the provincial professional planning associations. July 16th, Technology for Urban Green Infrastructure. July 27th, City Implementation in Small and Remote Communities. August 18th, Civic Technology in Atlantic Canada. And September 19th, Atlantic Water Network Data Stream. So those are all available on the API website. And so as we learn about them, we'll certainly be sharing those. And for those professional planners that need to record some continuous professional learning credits, that is actually, this title of this presentation has been added to the CIP Learning Web Network. And so if you just scroll down, you can certainly click on that with all of the information there. So thanks everyone for joining us, and hopefully in the course of the summer, NLAPP will be organizing another one of these webinars and build on the work from Pablo. Pablo, any concluding remarks?
It was a pleasure to hang out with you. I might crash some of your webinars. All of this stuff I find completely fascinating.
Thank you, Elaine.
Very much, everyone. All right, bye. Bye.